Now we got this contaminated mask that we had in our pocket. We handle it with a bare hand and we put it on our face.
Once you take microbiology, you can't unsee it.
There's a phenomenon called immune amnesia. It can literally wipe out all your immune system for around 2 to 5 years. It walks out of the office with them. So the bottom line is we can't not do it.
Hey, everybody. Welcome to the Dental Handoff. I am Dr. Kelly Tanner, and I have with me today Mary Govoni, who is a compliance everything to a lot of people. Mary, welcome to the show.
Thank you very much, Kelly. I appreciate your allowing me to be with you.
I have so many questions for you because I know that with compliance people, sometimes it's like, oh, we got to do that. But I know that after meeting with you, they're probably so much more comfortable and confident in what they're doing in their practice, right?
Well, that's the goal because most of the time when I start out with a practice or with an individual, they feel overwhelmed. They don't know where to start. And my job is to help them find the starting point and then find the end point for them.
That's awesome.
Yeah.
And make them feel good about it too.
Yes. Yes.
Mary, how did you get into dentistry? Why dentistry for you?
Oh, I got into dentistry completely by accident. I spent a year studying at Michigan State University and was being pressured to declare a major, and I had no idea what I wanted to do. My mother was a nurse, and she told me numerous times, don't go into nursing. And I might have done that otherwise because I saw her example. So, much to her dismay, I quit school and decided to get some kind of real world experience. And at the time, I had a part time job in retail, and I knew that that wasn't where I wanted to spend my life. And so, through a network of people that I knew, I met a dentist who was just a couple of years in practice, who was looking for someone to work in the business office. And back then, it was very unsophisticated. You truly were a receptionist, meeting and greeting those patients, and not a whole lot more. So, I worked for this doctor for about 10 and a half years. And in that time, I worked in the business office, and then we had a dental assistant, a chairside assistant who quit unexpectedly. And I talked to the doctor and said, hey, rather than put an ad in the paper for another chairside assistant, what about me? Would you train me? And he did. Is probably the most impactful person in my life. Was a great mentor, great clinician, very ethical, great with his patients, and I loved chairside assisting, but something inside me still wanted a little more. So on the weekends, I went back to school through a dental assisting program, became a certified and then a registered dental assistant in Michigan where I was living, and then finished up all my prerequisites for dental hygiene. And I worked chairside up until a Friday afternoon, and on Monday morning started dental hygiene school. And I knew after I finished hygiene school, I was teaching part-time, by the way, in the program that I graduated from. I knew that my heart was really in dental assisting. I gained a lot of experience with dental hygiene. Then I experienced carpal tunnel syndrome. And so I was having problems with instrumentation. And back in those days, this is back in the early 80s, by the way. We're not using ultrasonic scalers, and you know how that is. And so it was really tough for me to go back to work and do the same thing after I had a carpal tunnel release on both my hands to be able to continue. So teaching was an avenue for me, and I did that for a while. But then I started a staffing service with a friend and a partner. And while we owned the staffing service in the late 80s, we had our first OSHA standard that had a big impact on dentistry, which was the hazard communication standard. And back then, if you remember, we were getting unannounced inspections by OSHA in dental offices and these huge fines, and people didn't know what to do. So many of the doctors we sent temporary employees to were looking to us for some guidance. And we're like, okay, well, I guess we'll find it. So I studied as an OSHA Outreach Trainer with our state OSHA division and actually got so busy helping our client offices that I sold my partnership and then started doing compliance consulting full time. And in that time, many of the dental distributors were hiring me to come and do speaking. So that just started a whole new career, but it's all by accident.
You just fell into it.
Yeah, I did, literally, literally.
So many people in the industry have that. They're like, it's either kind of like one or the other. I found that it was very intentional and they planned for it their whole life is what they always wanted, or they fell into it accidentally.
Yeah.
Um, what a cool story because you got to experience firsthand the panic that people were in
Oh.
at that time, and you saw a big problem that you could help solve.
Mhm.
Were you at that time one of the only people doing it?
I was one of a handful. There were a number of people in university settings. Dr. John Molinari, who's well known in dentistry, and Dr. James Catone from University of Texas at San Antonio, and a number of other people who maybe were either in academic settings or in military settings who were doing some of that, speaking, not a lot of outreach consulting. So there weren't very many of us, and still not even until COVID. I think during COVID, many people who decided that they didn't want to go back into work in a clinical setting decided that I think I'll go be an infection control consultant or I'll go be an OSHA consultant, thinking that it's kind of an easy thing to do. But I'm here to tell you, it's a 24/7 undertaking just to keep current on what is happening.
Yeah, I was just getting ready to say, how do you it's like technology where it's evolving and 10 minutes later it's changed. And then by state as well.
Absolutely, and so that's the tricky part of what I do is having to stay up to date on what is happening not only in states in their occupational safety division, but their state dental boards as well, because there's a lot of regulation there that has to do with occupational safety, and then keeping up with CDC recommendations and doing research and all of that. So it's pretty time consuming, and I don't know, I guess maybe for those of us who do this, we try to make it easy, and maybe it looks too easy that other people think, "Yeah, I can just go do that. It's not that hard to do."
Yeah, just I stayed at a Holiday Inn Express last night. They don't understand the
True.
years of understanding and the do's and the don'ts and the things that work and that haven't and are evolving because your ear is to the ground. When you said that you have spoken a lot, that's so cool that you were tapped by the distributors
Mhm.
to offer that training. What a great service for the offices that you did. What's some of I know that you probably have like a top three of what everyone comes to you with, like, what do I do about blank? What are the top three things that people ask you or get your advice on?
Well, it's really interesting that you asked that question, Kelly, because I find that so many times, and more not to pick on dentists, but more so the dentists, and I understand where they're coming from because this is an expense for them, and they always have to be cognizant of the bottom line, but they're always looking for a workaround. Well, how can I get out of doing that, or do I really have to? And trying to help them understand that yes, the CDC has guidelines and OSHA has laws or rules, you still need to follow that guidance because it's the standard of care. So that's one of the first questions people, how can I do how can I get out of doing it or how can I do a workaround? And then for team members, it's well, my doctor says I have to do this and my doctor says I can only have one face mask to wear per day or something like that, and try to help them figure out an alternative that not to give them ammunition to go back and just, annihilate their doctor. We don't want to create any kind of a a combative kind of a relationship, but it's tough sometimes. Um, it's I think that there are more people that wanna do the right thing than there are people that don't care, but every now and then I run into some people who just like, "So what? Nothing's ever happened, and so I'm just gonna take my chances." I'm like, "Ugh, nothing's happened that you know of."
Right. Yeah. Oh, yeah. I guess I didn't think about that from your perspective of giving people ammo to go back to say, well, I just went to this course. I mean, hygienists are always doing that. I mean, I'm sure
Oh, yeah.
we start to, where we go back, it's like, why
Right.
keep you doing this? And all of a sudden there's an upset and everybody's not aligned and there's some kind of discourse
Right.
in the practice. Because I mean, with all of I'm just thinking about the mask example that you brought up. I mean, in hygiene school, it was, and I've been teaching for 27 years in different, dental hygiene, dentistry, perio, all the things. And it was that you, you change it when it gets soiled, when you feel that it's wet and, or between patients.
Yeah.
And that's what you do. And then we came to the N95 and all the respirator and Darth Vader stuff, and then you just kind of wore it every day because there was a shortage of them. So I think people got confused on all of that.
Right. And I think they're still confused because they're still reverting back to the days of the pandemic when the masks and the N95s were in short supply and well we got to reuse them then. Well, that was only by emergency order from the Food and Drug Administration. And because they were in such short supply that I was in a practice not long ago where the doctor had a habit and as did many of the team members of taking their face mask off and putting it in their pocket and then they would take that same face mask off and put it back on their face and use it again. And so now we got this contaminated mask that we had in our pocket. We handle it with a bare hand or we put it on our face. We contaminated our hand or we contaminated our glove. It's like take it off and throw it away. They just don't feel vulnerable, I guess.
Because they can't see it.
Yeah.
They can't see the once you take microbiology, you can't unsee it.
That's right.
I feel like I always say that, but you cannot
True.
unsee it. And just to know how, if the saliva were red video, you can't unsee that.
Right. Right, but yet people ignore it, like, "Oh, yeah, it's not a big deal. I've never gotten sick," or I haven't had people during, some of COVID, I remember being at, the Rocky Mountain Dental Conference, and somebody in the audience said, "Exactly how many people have gotten COVID at the dental office?" Like, "We have no idea." And hopefully none, but we don't have any idea, but many of those people just really want that hard data to prove without, any doubt that you can't get that there. And, now we're dealing with the whole issue of measles, which is scary.
Yeah, I haven't looked at the news in a minute on that, or I try to stay away from it as much as possible. I kind of check in to say what's going on to know a little bit of it. Since we're on that topic, where does it stand? Is it more? I mean, I know that there have been outbreaks. Is it contained? Do you know the latest?
Well, yes, there are outbreaks in many states throughout the country. I think the latest ones have been in South Carolina, in Utah, aside from the one in Texas that was so well publicized last year. But it's occurring everywhere, and you've probably heard that by 2000, we essentially thought through vaccination that we had eliminated measles in the US. And then we started having vaccine hesitation and less people getting immunized and they're spreading. One of the most recent revelations that's been publicized about measles, which is very easy to transmit, it's one of the most infectious respiratory infections that we have. And what's been discovered is that there's a phenomenon called immune amnesia. And if you get a case of measles, it can literally wipe out all your immune system memory, like everything you've accumulated in your lifetime for around 2 to 5 years. So you're just starting over with no B cells or T cells to protect you if you're exposed to any kind of an infectious disease. So for dental professionals, my mission is get them to get an immune titer test done to find out if maybe they need a booster um, immunization for measles because maybe their own immunity has worn off, and to really be screening for patients, especially children, because it's more prevalent in children who have respiratory symptoms and a fever, and reappoint them. Don't see them because they can be infectious not only to other patients, but they can certainly be infectious to the team.
Wow. Yeah, the titer is a piece of advice that people don't they realize that I'm thinking about hepatitis B.
Yep.
When you first get it, when you're a baby, when you're older, when you enter into dentistry,
Yep.
there's the check mark that you have to do this. I remember when I started teaching at Virginia Commonwealth University when I was just a baby hygienist, and, um, I was like, "You know what? Something just told me to get my titer checked." And sure enough, and that was at the age of, I don't even know, I was, like, in my late 20s,
Mhm.
early 30s, and I have all of this to go through, meaning, like, my entire career to go through, but many of us just assume that that coverage is there, and
Yeah.
it's not a magic number because our biology is all so different, and we are processing these vaccinations differently. So
Right.
as a PSA for you, if you haven't gotten it, and I think I might take my own advice on this to go uh, check in to Mary on my measles. And what other types of titers can be run in these?
Well, there's a whole gamut for in vaccine preventable diseases. Um, Measles really from at the forefront right now, but also we're seeing in many cities in wastewater, which is where many of these infections are being actually detected now, resurgence of polio in some areas, and especially if somebody's going to do international travel, because there have been polio outbreaks in Europe and Africa. If you're going to travel, especially to South American countries where measles is very prevalent, it's good to go to the travel office. The CDC has a great travel web page that you can go to and just click on what part of the world you're going to travel to, and it will tell you what infectious diseases you may be potentially exposed to and what kind of vaccines you might need to get boosters on. My husband had polio as a child, and it can be latent and it can recur from an exposure. So I pushed him to go and have a titer test done and to get a vaccine booster because it's terrifying to think that you could get polio again. That's scary.
Yeah, and that's fascinating, fascinating. So go get your titers checked,
Yeah,
everyone. PSA here.
absolutely.
Yeah.
Absolutely.
So, how offices are coming to you now to say, how do we start? Where are we? How do you start with them, Mary? I'm sure there's an intake process of like, where are you? What are you doing? How do you simplify it? Help offices simplify this?
Oh, great question. We start with a checklist. And so we go through a checklist for the bloodborne pathogen standard. We go through a checklist for the OSHA hazard communication standard. And then we look at things that are just general safety issues that are covered under OSHA's general duty clause, which in essence says that every employer is required to provide a workplace safe from known hazards. And then I look at what are the medical waste or hazardous waste regulations in their area, in their particular state. And we identify where they're compliant, where they have deficiencies. And in many cases, they need documentation. Most practices do, for the most part, the appropriate things for occupational safety and patient safety, but they don't necessarily have them documented. And in OSHA's case, and in a legal sense too, if it's not documented, it's considered not done or not being performed. So the challenge I have right now is trying to wrestle these paper manuals away from dental teams and go electronic because it's so much easier to edit and to update and to find things. There are folks with these 7, 8 inch thick binders of safety data sheets, and they'd be hard pressed to find one in an emergency rather than go to the computer, click on a folder, look at an alphabetical list, and now I have my safety data sheet that I need.
That's right. And are you even doing that? Do you know that it's required to have your yes.
Right. Well, and there's a new hazard communication standard that was passed a year and a half ago that takes effect for employers in November of this year. And so practices will have to start updating all of their safety data sheets between 2026 and 2028.
Oh, wow.
Yeah. So there's always something new, there's always something happening or changing.
how do people find out about this? Like, where is their go-to source on the thing? I know with like CDT codes, there is like the ADA website that can have. I get my good old fashioned, confidence with coding from Charles Blair, CDT code.
Oh,
So
yes,
I love
absolutely.
that. I love that
Yeah,
book. People are like, you should get them to sponsor you. I just love that book. It just
I do
it
too.
just makes life so easy. But where is the source that people can go to for this?
Well, one of the greatest sources we have is called the Association for Dental Safety. It used to be called OSAP,
Mm.
and it's been in existence for 40 plus years. Came out of all of the concerns in the early days of the HIV epidemic, and it focuses on all things safety in dentistry. So, any of your um, podcast listeners, watchers can go to myads.org, and they have an annual conference. They have a boot camp that, somebody who's maybe new to dentistry or who needs refreshing on, infection control protocols and so forth. And they have tons and tons and tons of resources, but it's still kind of one of the best kept secrets in dentistry. So I would say a lot of times dental team members maybe rely on their state dental associations, maybe the American Dental Association, or their sales reps to let them know, what they're hearing that's going on. But also, there's a lot of great webinars that are happening online for people to know what is happening. One of the things that I do is work a lot with the Hugh Freedie group, and they have a compliance program, a compliance system called Greenlight. And we do webinars every quarter, now every 6 months, to keep people updated. But there are good resources for people to go to.
Yeah, I'm just thinking that there's so many things to keep up with and to be able to click, okay, I live in Virginia.
Mhm.
All the things here's suggested and here's the law. you
Yeah,
know,
yeah,
guidance doesn't mean it's optional.
yeah. If only everybody understood that.
Guidance means it's kind of breaking it down because it's kind of important. It's like it's like regulatory guidance documents that
Yeah.
says, okay, this is how it plays out with this. That's great advice, Mary. Thank you for that. And I've heard of the Hugh Freedie program that has taken that on. So I'm glad to know that you're teaching there.
Mhm.
How do offices work with you, or how do people work with you, or how do you um where do they see you speak? Like, how do they get in touch with you? Or
Well, I speak all over the country, a lot of state dental associations and in local study groups and those kinds of things. And I do a number of webinars for different groups and companies. And so they can reach out to me at my website, marygovoni.com. And it's easy enough to kind of get started. What I usually start maybe with a video call, so we kind of get to know each other and see what it is that they're looking for. Sometimes it's the OSHA manager who just needs a little boost, or they need questions answered, information where the favorite question is, where does it say that I have to do this? And so they want to know. I'm like, oh, hey, you can go here in the OSHA bloodborne pathogen standard, or here's some information from CDC that you can take back to your doctor. And so I love working with practices that especially want to do the right thing and are interested in getting things organized. Especially with a lot of turnover, it's typically a dental assistant who is the OSHA manager. They have a little more freedom or free time in a practice than a hygienist typically does. And then when that position turns over, a practice either may not reappoint somebody, or they don't understand what kind of a system the other person had. So I really try to help them create a system that is sustainable and easy to understand, easy to update, and that they always know that they can come to me if they have questions, or I can refer them to other experts as well.
yeah, it's like you read my mind, because I was just going to ask, when you were talking about the person who's in charge of OSHA, what do you do, or what do you recommend when there is team turnover? Because there's not this handoff that happens because people don't always leave a practice on great terms or in a way you prefer and just say, okay, I'm giving my 2 weeks. Here's everything. And I've trained the next person. That's not the reality in
No.
dentistry.
And Kelly, sometimes that person may have been the one who put all the OSHA documentation together and they feel ownership of it and it walks out of the office with them. So then some practices are left with nothing or it's been filed away somewhere and they have no clue where it is. And so if they did get, it doesn't happen very often, but if they got a surprise inspection from OSHA, the first thing they want to see is documentation. And if they can't find it, boy, there's gonna be a lot more scrutiny of that practice from that inspector.
It seems like Mary, and this is just the way my brain works. It seems like it should be a centralized kind of software that you can. I'm making this up. You probably know like 12 of them. That is like a template where you say, okay, I'm Dr. Tanner. I own this dental practice. I'm just going to upload all these files. And it's a centralized place that everyone has a uniform login to and can be aware of it.
Actually, there is, and, there are a couple of them out there. The one that I am most familiar with and that I really like is called EFFEX, EFFEX, and they have they have the platform that I've been searching for my whole career, and I did not have the resources to create something myself, but they have a fabulous platform that essentially keeps everything organized. The struggle that we have with a lot of practices, though, is they believe that they can do it themselves. They believe that it doesn't cost them anything if they do it all themselves. And so when they need to pay a subscription fee or a monthly fee for an automated platform that actually saves them time, there's a little bit of reluctance there. But nobody's staff time is free and it's not free if you're doing it yourself. You're costing the practice a lot of money in downtime in trying to get that information together or risk if you don't have it together at all.
Yeah, because I'm thinking about the evolution of everything from the three-ring binder with all the MSDSs in the sleeves, if you were lucky, or in pockets, or things shoved in a folder of like new stuff that just came out of the boxes that were shipped in, right? There's that version. And then all the, again, like the three-ring binders. And then there is the file folder, the Dropbox that everything is dropped in, which is fine. But again, like you say, does everybody have the passwords? Does everybody know where it is? And then where we are with the central data point of things that are there, does it need to be encrypted? I don't know. Maybe it does based on the sensitivity of some of the information that's uploaded in there with
Yeah.
buyer information. But this is where everything is going. So if you're listening to this, Mary's a wealth of knowledge. Reach out to her. And my whole thing is with this, just as much as you can. If you don't know the answer to it, ask someone who does. Reach out to someone who does, because every single person is required to do this, and every single person has to start somewhere. But Mary, I know that you know this about your clientele. They probably don't want to tell anyone their dirty secrets that they're not already doing it.
Exactly. They don't want anybody to know. And it's a very emotional thing when, we start going through a compliance checklist and they say, no, we don't do it, or oh well, we used to, or I don't know. It's like, okay, I'm not judging. I'm just trying to get you to a point where you know what needs to be done and how can we make it work for your practice. And also looking at how can we do this in the most affordable way possible, but the bottom line is we can't not do it.
That's right. Ah, I love this. I'm so glad that you're doing this. And if you have questions for Mary, her information is in the show notes of this episode. And if you are watching this on YouTube, they're right down below. Please, if you're watching this on YouTube, drop a comment in, a question for Mary. I always ask that everybody subscribe and like so you are notified when any new episodes drop. Mary, where are you speaking next so people can find you?
Next week, I am speaking at the California Dental Association meeting in Anaheim. And I also wanted to mention that one of the other things that I do is I have a podcast with three of my colleagues, Leslie Canham, Linda Harvey, and Olivia Wan. We call ourselves the Compliance Divas. And you can go to our website, thecompliancedivas.com, and subscribe. And we cover all things compliance. We talk a little bit about HR, we talk about HIPAA, we talk about OSHA, we talk about everything.
Thank you for that, for putting those good words out there into the universe so people can consume it. Because if it's in a book, they may not get to it. You- on audio, right?
Yeah.
Well, if you're going to CDA, check out Mary, and I'm sure that if you reach out to her, she'll let you know how you can work with her or advice that she can provide and get you on a call. Mary, thank you so much for being on with us today.
Thank you, Kelly. I appreciate it very much.
Yeah, for all of you all listening, you know I love you, and I always ask the favor. Please go on to Apple Podcast to give the dental handoff a 5-star rating, please, 5 stars. And then again, if you're watching this on YouTube, please be kind and do subscribe and click like and drop a comment. And we will see you next week, my friends. I love you and thank you for all the great work that you're doing. Thanks again, Mary.
Thank you.